All right, thank you all. So I'm going to take a slightly different approach and really talk about some of the things that have led to what we now have in this, how we got to this 5,700 sample. But I'm going to talk a little bit about some local efforts as well as, how do I advance? Okay, got it. So what is engagement? What has been done nationally, what has been done locally, and then I'm going to talk about how can we keep the conversation going, because we often talk about, I know it's going to be a little bit of a different conversation from the basic science perspective, but all this tissue and all this diversity that we talk about that's needed in precision medicine, we have to think about how do we get those diverse samples? How do we get those tissue samples? And so one of the things that has come up early on in the Precision Medicine Initiative, now called the All of Us Initiative, is that we have to be careful that precision medicine does not create a larger gap in healthcare access and resources. And I'll share an anecdotal story of one of our patients who I'll talk a little bit more about later, but she talked about the care when she was diagnosed with her breast cancer, the care that she got, the clinical trials that she was offered when she had her Blue Cross Blue Shield at Northwestern. But through life circumstances, she lost her Blue Cross Blue Shield, and this was pre-ACA, so she had to get her care at a safety net hospital. So she started her breast cancer treatment at a private academic institution only to go to a safety net hospital. And she asked the question, where are my clinical trial options? Where is my precision medicine options? So when we think about advancing science through precision medicine, we need to make sure that we do not lose this concept of social justice as an aspect of precision medicine. And so I want to thank, and I want to start off too by talking about what is community engagement. We often talk about it as this soft science and thinking about community engagement as just going out to an event, talking to some people, having a table there, but it's really a lot more than that. And Community Campus Partnership for Health defines community engagement as the application of institutional resources. So there's actually, this definition of community engagement actually went to the IOM, the Institute of Medicine, to actually inform institutions to say that you have to do more than just talk about engaging your community members, but you actually have to have resources set aside to ensure that this takes place. So, and I want to show you an example of community engagement in the context of research. And actually, Dr. Dean, this was a project that was a case study from Vanderbilt done by Dr. Consuelo Wilkins. She actually saw that by doing community engagement, this was an NIH-funded study that was drastically under-enrolling and underperforming. The study then came to a community engagement advisory board, and as a result of just a one-time meeting with community participants, the study protocol was revised, the consent form was revised, the recruitment elements were revised, as well as one of those patients, a patient that was dealing with the cardiovascular condition, was brought on to the study. And as a result of community engagement, this study actually ended up not only meeting its enrollment target, but actually meeting the enrollment target early. They end up building trust. It identified priorities of the research protocol that were not there before. And it also improved the science, because we all keep saying that the more diverse the patient population, we know that that's going to advance the science. But then also expands the reach of the results, because we talk about this whole concept of implementation, but we also have dissemination. So we all know that we're going to read our dissemination findings in Tier 1 journals and top journals, but how does that get to the community? How does that get to the everyday lay population to know that they should be asking to be enrolled in one of our precision medicine initiatives, including the All of Us Research Initiative, but even other projects that you have going on? We want them to be asking about, do you have a trial for me if I'm diagnosed with triple-negative breast cancer? Do you have a study for me? I'm a new diagnosed with prostate cancer at stage 1. What are my options to ensure that I'm getting the latest and the most advanced treatment? So, and this is an example of the national community engagement effort, and Dr. Denny started talking about this, but we actually conducted 77 with leading at Vanderbilt. Vanderbilt was given a small pilot award to actually conduct 77 community engagement studios covering over 6 topics with over 654 participants across 19 cities, including here in Chicago. And 60 of the studios are also associated with the Federally Qualified Health Center. And we actually conducted one here in Chicago, and so after I met with Dr. Wilkins, we talked about who was not at the table, what populations have not been included, and there was a lack around the country of including American Indian and Native American populations. And many of you may not be aware of this, but Chicago is one of the few cities to actually have a community-free clinic up north in Chicago associated with the American Indian population. And so because our cancer center is building a trusted relationship with that community clinic, we actually conducted one of the engagement studios at that clinic. And what we found out interesting from conducting an engagement studio at that clinic clinic is that they said something very interesting to us. They said, this is the first time we've actually been approached about being involved in research before the protocol was written. And because you approach the engagement this way, we're more likely to now be a partner with you. So we're actually working with that community clinic on a large spread colorectal cancer screening project. We're working with that community clinic now on tobacco cessation and screening project because we went to them before we actually wrote the protocol, building this trust and building the relationship. And so this is an example of a national effort. And as a result of these national efforts, we began to identify, and this is what I call the science of engagement. If you do community engagement right, it actually has science, and it can be specific, measurable, achievable, reproducible, and in a timely manner. We all know what SMART objectives are, right? And so these are 3 examples of personas that actually came from these community engagement studios. We saw that these represent 3 different types of people that you as a researcher, if you do human subjects or human participation research, are likely to go into approach someone. And so what these engagement studios taught us is that ready to go was Edgar. He was someone that was ready to be engaged in research. He said, you know, I've heard about research before, and I want to get this. We see this sometimes in the community as well. We had a patient recently tell us, I want to get the same type of treatment if I were at one of the larger premier hospitals. And I had to tell them we are one of the larger premier hospitals. But they said they wanted to get the same access to clinical trial. And that persona is what they called Edgar here. But then there was security afraid Sonia. So one of the things that came up locally and in Chicago specifically, but in other urban communities, was this concept of data breaches. You know, I'm going to give the government my information. You know, and this is in the era when you hear about the Target breaches, you hear about other large breaches from other online, shopping organizations. So now we're going to go to patients and say, you're going to get your data in this large national platform. So, but knowing that this persona exists in security afraid, and then curious but distracted. This is what I want to point out to you, curious but distracted, because this is often the patient that says, you know, I would love to be a participant in your clinical trial, but you don't provide childcare. Your hours are for your clinical trial operation. Your recruitment hours are from 8 a.m. to 5 p.m. That doesn't give me time to get to my hourly job. And if I come to your recruitment site to enroll and I work an hourly wage job, then I'm likely actually going to lose wages for participating in your research study. So that's the persona we call curious but distracted, saying I would like to be enrolled, but you haven't really designed your study to allow me to be enrolled. And these are just 3 examples of the various personas that we got from understanding data that came out of the community engagement studios to help lead these efforts. And I won't go into this slide, but it talks about the difference between community engagement studios and focus groups. And our Cancer Center is we are more than willing to have a conversation with you if you'd like to learn more about what community engagement studios are and how you can use them to even help inform your basic science research. But I'll also talk about the national effort by ending here. So one of the things that happened, as Dr. Denny talked about, was you saw that picture of us when we were in Bethesda when the study was kicked off. But the NIH did, under Eric Dishman, did also something very innovative as well. They did a call for proposal for community partners to come to the table. This call for proposal came directly out of community requests. Several of the early engaged partners were asked to bring patient advisors to Bethesda. So we brought patient advisors to Bethesda. The Cancer Center brought patient advisors from the Chinese American Service League, the Puerto Rican Cultural Center, and Miles Square Health Center, as well as Trinity United Church of Christ. We took 4 patients with us to Bethesda, and there were several other partners that brought their patient and community partners as well. And those community partners said, we want to help you in this Precision Medicine All of Us initiative, but we also see that there are several voices that are not represented around the table. We also see that the funding is really not equitable. We see that, yes, you're going to compensate me for participating in the study, but if you want us to help you with enrollment, we also think that we should also be a PI possibly. And the NIH heard that, and I applaud them for hearing that, and they did a national call for proposal for community engagement. And out of that national call arose these 4 entities that were funded. So the San Francisco General Hospital Foundation was funded to think about how hospital organizations as a system can come together to talk about the importance of precision medicine. Delta Sigma Theta sorority was funded through the Delta Research and Educational Foundation. And my sister is actually a member of this national sorority. It's the second oldest African-American sorority that exists. And so imagine now what's gonna happen when African-American women and their families see that they have the trust of this national organization that's been around since 1913, with premier members all across the country. So as a result of this organization being around the table, they have a widespread national initiative to engage African American families. They're going to be going to family reunions. They're going to be going to college campuses, talking about engaging in the Precision Medicine All of Us initiative as a family. We also have Latino families and communities involved through the National Alliance for Hispanic Health. And then also thinking about how do we engage the older and aging population, because a 54 is not old at all. But it is talking about how do we engage the aging population. Particularly, this was a concern because we think about the digital divide, and as we think about a mobile app and mobile platform, how do we engage those populations that may not be as comfortable as others? And so I applaud the NIH in really listening to the community need and having these new community partners come on board. So this is what was done nationally, but we had to address some things locally here. And so through Dr. Nguyen's vision, one of the things that happened is that when we began to talk about the Precision Medicine Initiative, now called the All of Us Research Program, we actually took it to a group of our community members. And you see a picture here of one of our patients. Her name is Rosemary Rogers, and she agreed to let me use her name. As Dr. Nguyen has a group of patients that actually advises him. They serve as beyond the community steering committee, but they're his patient advisory board. They advise the leaders of our cancer center. They advise us on how we disseminate findings and also how we design our research. And one of the founding patient brigade members said to Dr. Nguyen, I'm concerned that we will start this initiative and we will not address some of the historical issues that we know have led to some of the medical mistrust that have caused underrepresented minorities to not participate in research. And she said the things that we often don't like to talk about. She said Tuskegee, but we also then, Dr. Nguyen reminded her that it wasn't the Tuskegee study. It was actually a national public health study that happened in Tuskegee. So even the framing of the fact that study gets by talking about it as a Tuskegee study actually is part of the problem, because it makes it seem like that study is associated with a particular town in Alabama, right? And then she also said, and I'm also concerned about the Henrietta Lacks story that was coming out on HBO. And this is what can happen when you have some really innovative and talented young people around your team, not me. We told that the Henrietta Lacks story was coming out on HBO, and so one of our clinical research coordinators called HBO. And she said, can we get a copy of your movie so we can show it locally? And they said, yes. And then the idea said, then Dr. Nguyen threw out to that young person, said, wouldn't it be cool if we got the family of Henrietta Lacks here to actually talk about the movie as we show it? And come to find out, they had an agent. So next thing you know, the family of Henrietta Lacks is on a plane here in Chicago, and 700 people later, they're here in this actually very room talking about their experience. And ironically enough, their discussion was not about the importance of medical mistrust, but it was the importance of everyone being at the table. So best practice when we talk trust is built, and this is just another example of what has happened as we work with other organizations about like PCORI, talking about this community engagement, but also local efforts with on the table here in Chicago. So advancing trust by acknowledging the past to inform the future. This is actually, I want you to pay close attention to this picture here. This is actually 4 generations of Henrietta Lacks. And we all know the story of Henrietta Lacks, right? A young African-American tobacco farmer who was not approached for consent to use her cells, but her cells go on to change the course of translational research as we know it today because her cells became HeLa cells. We all know that story, but we also know that that story is somewhat cast a dark cloud over our history in terms of research. There's one of those stories where we say that led to what people like my father, who's from Arkansas, and my mother, who's from Mississippi, talk about in terms of why they would not likely participate in research. And so because we wanted to make sure that we addressed this from a community engagement perspective, we had 4 generations of the Lacks family here. And this is what they said about Chicago. Chicago, everything I've seen today, Miles Square, you are keeping the community engaged. You are exactly what we are about. So the family is not saying that they actually don't want research to advance. They are a huge proponent of precision medicine, and even now a growing champion of the All of Us Research Program. What they simply said is that we want to be at the table. And this is an example of who was at the table. We had 659 people registered for the event and approximately 518 attendees. And of those who attended, 85% said they knew the story of Henrietta Lacks, and they said that that's why they actually wanted to come. And of those 518 attendees, over 50% of those attendees were from the public, because they said we had never really been invited to an academic setting to really talk about this concept of medical mistrust, and medical mistrust that is engaging the family of Henrietta Lacks. And from this, you think about diversity at the table can advance diversity in research. So these are the participants there. So over 49% of the attendees were African American, 23% of the attendees were white, and 18% of the attendees were Latino, 8% Asian, and American Indian 2%. So what if our research studies look like this? So what if we were able to engage every single participant that came to that Henrietta Lacks event? What if we were able to build trust and engage that same population in research? I think that would achieve some of the quadruple diversity that we talk about as the mission and goal of the All of Us research program. It would help large national data sets. It would help the SEER data set to really have samples that represent populations that carry the greatest burden of disease. And this is just an example of the questions that we asked. So we actually did a survey, got it IRB approved, to do a survey at that event just to ask the community too, what other things do you want us to talk about as we advance trust in medical research, and what do you want to do? And one of the things we heard back from some members of the Latino community said that we want to have this same conversation about medical mistrust in the Latino community, because there may be some different nuances to why our population and our communities may or may not participate in research. And then the other thing that I want to talk to you about, so these are all efforts, I highlight these examples to show you that through community engagement, you can actually advance trust in research that can be a proxy for participation in clinical trials. So today's conversation positively informed my views on how trust in medical research can be advanced through community engagement. Strongly agree was over 58%. And as a result of today's conversation, I am more likely to talk to my family and community about the importance of clinical research. 66 people. So that 66 people in that very diverse room are now saying that they would now go home and talk to their family members about the importance of participating in research. So how do we advance trust, the community response? These are just some qualitative responses from the surveys that we collected. Continue to promote community engagement, community awareness and engagement. Trust will come when people know who you are and what you do. Make things, and that's the direct quote, are clear and easy to understand as possible. Appeal to the public interest. Thank you for all the great work that you do. Another community member said, in conferences like this, healthcare providers should step up, acknowledge, and take responsibility and ensure the communities that it won't happen again. In discussion, please indicate the healthcare providers who state what change they've done and what they are planning to do in order to get the community trust again. So it wasn't about saying that mistakes will not happen, but it's about acknowledging those mistakes and saying how you learn from those mistakes. These are the two direct quotes from community members who attended that. And I like to highlight this picture too. So this is the actual daughter-in-law of Henrietta Lacks talking to one of our patient brigade members. So this is a patient brigade member actually sharing her experience as a patient who helps inform our cancer center leadership on what she would like to see. This is Carol, who was diagnosed right here in Chicago at one of our federally qualified health centers. And Carol's story is an amazing story. She said without us having a federally qualified health clinic in Inglewood, she probably would not be here today to tell her story. But because she had a primary care physician in our Inglewood clinic who listened to her and who said, no, you're right, something does not sound right. Carol was diagnosed with the early stage breast cancer, went on to be treated, and now Carol is one of our patient advocates and patient champions. So Dr. Nguyen earlier showed you the family of DJ Timbuktu, who actually was, he unfortunately passed away early due to renal carcinoma. But although he could not be a part of the patient brigade, his parents are actually part of the patient brigade, and they attended the event with Henrietta Lacks, and they also met the Lacks family. And so this is a quote from DJ Timbuktu. He said, "Your struggle is my struggle, and I'm here to fight with you. To the ones with too much pride and don't like going to the doctor because they are too proud and can handle it all, I have high hopes that my journey and story brings you back down to earth." So imagine this young man saying that I wish I had a clinical trial that could have cured my renal cell carcinoma. This is a young man under the age of 40 saying that diverse participation in research is very important. And his parents are here today, not in this room, but they're here as part of our Cancer Center Patient Brigade, informing us as to how we can advance this. I'm actually meeting one of the members of the Francis Jones family this evening in Woodlawn, and I'll talk a little bit about that project later. So this is Dr. Dara Richardson-Heron, who is the Director of Community Engagement, Community Engagement for the All of Us Precision Medicine Initiative. And she actually was the moderator of our panel that we had with the Henrietta Lacks family. And I also show this picture to show you the next generation. These are students that were all got their books signed by the family of Henrietta Lacks, but also students that were part of our NCI-funded U54 grant who are very interested in advancing the pipeline. Because the other thing that the community says is that if you want to advance the diversity in clinical research, you also have to think about advancing the diversity of the scientific workforce. And so I'll end with this. So the Indelo Institute is having an annual community meeting on citizen scientists. So what is a citizen scientist? A citizen scientist is a community member that says, hey, I may not have a PhD, I may not have a doctoral degree, I may not even have a master's degree, but I'm interested in advancing science through community engagement. And so at the Cancer Center, we came up with this concept. We didn't invent the term, but citizen scientists are community members that will actually help tell us what they think needs to happen in terms of recruitment, community engagement, advancing medical trust. So in this library you see here, I don't know if you can really see it, but this is going to be the opening of the first library on the south side of Chicago that's directly devoted to health data. So it's going to be a data repository on this, a library on the south side of Chicago where patients who they can go and learn what is precision medicine. How do I sign up for an All of Us research study? How do I go to clinicaltrials.gov? How do I learn what research studies may be aware in the community where I sit if I don't have access to this? So we'll be talking about this type of medical trust tonight from 6 to 8 p.m. at Morgan Park Sports Center. And I'll end with this. Thank you for, this is an example of our patient brigade member. You see Ms. Rosemary Rogers there, one of our inaugural patients. And you see several other members of the patient brigade members there after they met with Dr. Nguyen to tell them what their concerns were and how they wanted to help advance this research. And it was at this meeting where the idea for the Henrietta Lacks event started. So just want to acknowledge the Henrietta Lacks family members, as well as want to honor in the life and legacy of Dr. Cynthia C. Barnes-Boyd. A lot of the work that I do, that I've been blessed to do in terms of community engagement, comes from mentors like Dr. Cynthia C. Barnes-Boyd, who was doing community engagement long before it was even given a scientific term, who was doing community-based participatory research, CBPR, long before it was given that term. And many of you that are local know that Dr. Barnes-Boyd actually passed away this year, earlier this fall. So I always like to honor her and the work, her legacy. And also like to thank Dr. Ashish Ansel, Dr. Lisa Anderson-Shaw, Carol Giametti, and Rosemary Rogers, who are active in our patient brigade, but also were active in our Henrietta Lacks event. Thank you so much.